Hi everybody and welcome back to my channel. Today I will be talking about amblyopia or lazy eye. This condition tends to be very confused amongst the general population with respect to what it is and the key difference between a lazy eye and a squint, which is a turn in the eye. If you'd like to learn more about lazy eyes and amblyopia and how they develop and how they are classically treated, then please do stay tuned to watch and learn more about this. Thank you. So I will begin with a plea. Please do click the subscribe button if you find this video or any other videos useful. So today we will be discussing amblyopia in this short video. Amblyopia is frequently referred to as a lazy eye by members of the public, and essentially the key thing to outline from the offset is a lazy eye or amblyopia simply means that one eye sees less than the other eye. That's the first thing. And the difference between that and a squint or a turn in the eye is exactly that. A squint is a turn in the eye, either in, out, up or down. And an amblyopic eye is an eye that does not see as well as the other eye. So that's the first important thing to establish. Amblyopia comes about because one eye is used less than the other eye up until the age of around 7. This means that the brain tends to give preference to the inverted commas normally developed good eye. There are several causes of amblyopia, but just for the purposes of this video I'm going to focus on some of the bigger, more common causes and reasons why individuals develop amblyopia. So the first classic reason why patients can have the underlying condition of amblyopia is because in fact they do have a turn in their eye. So if we use the example of an individual that has a turn in their eyes whereby the eye is turned in, this means that if that individual is looking straight ahead, their right eye will be looking at the target that they desire to look at. However, their left eye will be looking off axis and at something different. This means that the correct visual processing will take place with respect to the right eye, which is looking at the target in question, but the left eye will be looking at a different object. Essentially, the brain will then confuse this information coming into it, i.e. the right eye is looking at the correct object, the left eye is looking at something else. And what tends to happen is the brain will then choose to ignore the image coming from the left eye. This happens because if the brain chose to not ignore this image, it would end up seeing double. So it's the lesser of two evils in one respect. Rather than seeing two images and two confusing images, the brain will selectively choose to use the image from the right eye, which is looking at the object in question, and will block out or suppress the left eye, which is not looking at the object in question. This then over time can lead to poor development of vision in the left eye, because essentially the information it's feeding into the brain is being suppressed or inverted commas ignored. Another reason why the visual information that is being fed into the brain may be confusing to the brain, and therefore the brain may choose to selectively filter or block one of the eyes, is if there is a marked difference in prescription between the two eyes. So if one eye, for example, has a prescription of +1 and the other eye has a prescription of +8, then the eye that is very long-sighted may be the one that is selected to block the image out from and suppress it, because in that context the images coming from the two eyes are so different that the brain cannot fuse them together into one image to provide clear binocular, i.e. 3D vision. So therefore in that context again, the image that is providing the confusion will be suppressed or blocked. The other way that, or the other reasons why patients may develop amblyopia is for reasons such as if an individual has a droopy eyelid, so therefore light and visual stimuli are not coming into the eye. And the other reason, which is very common in the developing world, is in individuals that are born with cataracts. And again, this represents an obstruction to proper visual development. After being referred and being seen by the appropriate practitioner in the hospital setting, what will then happen is, after a thorough comprehensive examination is performed, if an individual is deemed to have amblyopia and is deemed to have a prescription that is correctable to improve the vision slightly, then this will initially be prescribed. However, by definition, the amblyopia will still remain after a prescription has been prescribed that is needed. So, for example, if an individual sees halfway down the chart without glasses, they are deemed to have a prescription, and that prescription is prescribed, and then they are able to see one line better. That may be the best corrected vision for them, with the opposite eye seeing the bottom line of the chart. So there is still a difference between the two eyes despite the glasses. Then patching is usually started, and patching simply means that the good eye is blocked out, i.e. a patch is popped over it, so that this then forces the left eye, which is the amblyopic or lazy eye, to essentially do more work and process more information. And the aim is to try and encourage it to see and therefore develop. Other methods that can be used include using eye drops to blur the image in the good eye. So in the example I'm using, drops will be popped into the right eye to blur the image, and therefore again encouraging the left eye to work. So factors dictate how successful treatment for amblyopia will be. This includes, but is not limited to, how early the problem is detected, how early management plans are instigated, and also another key component in the management of amblyopia is the cooperation of usually young children. Unfortunately, if amblyopia is not treated successfully, then patients will be left with a permanent visual deficit. This is why it is important that the condition is identified as early as possible, and then treatment can be actioned. Without saying, depending on what the underlying cause of the amblyopia is, then the condition that is responsible for amblyopia potentially will need to be treated. For example, if there is a cataract that the individual has in a certain eye, then the cataract will need to be removed. If a droopy lid is causing the problem, then this droopy lid will need to be rectified. If there is a squint, then some squints will correct with the use of spectacles, whereas other squints may require surgery to align the eyes, and again therefore encouraging the amblyopic eye to start processing visual stimuli and therefore start to develop. Brings me to the end of this short video about amblyopia / lazy eye. I hope you have learned more about this condition, how it can potentially have devastating lifelong impacts on individuals if it is not detected early and treated early. If you have found this video useful, please do click the like button, the bell icon to stay up to date with videos, and please do subscribe to my channel, as it would be an enormous help. Take care. Bye.